think, like anywhere across the UK at the moment, the demand for our services has risen. The population has changed, become more frail elderly patients that are coming in as emergencies. So we've had to respond to that. And the way that we've responded is by looking at what the needs of those patients are and how we manage those needs across the 7 days of the week, really. From a safety perspective, I mean, there are core members of staff who are responsible for the care of those patients, and they were obviously making sure that the care was as safe as it possibly could be. However, I think that when we looked at the needs of our patients, we could see that generally across the weekend we couldn't respond in the same way. And I think we have an obligation to our patients to be able to respond to them when they need it. And I think the demand on our services meant that we've probably gone to 7-day services without thinking about it really, in a way, because what we wanted to do was respond to the needs of our patients, and to respond to the needs of our patients we had to work differently. So people have taken on weekend working in a very different, they have a very different attitude to it really, because we talk about it from a patient perspective. What do our patients need and how we're going to meet that need? The challenges really will be the same across the whole of the NHS, I'm sure, and that is that to put in 7-day work, and everybody thinks that you're going to need more staff or more of the same staff, more of the professions, the physios, the OTs, probably more nurses going into extended roles, more doctors. Actually, I think you've got to look at, again, what do your patients need and how can you meet that need by looking at the workforce and developing it in a different way, developing new roles with new competencies and skills that can support the registered professions and the doctors to deliver the care that's required for patients. So you have to be open, I think, to thinking about meeting a need in a different way. And we have nurse practitioners and advanced nurse practitioners, but it's also about our allied health professionals, looking at extended roles for them. And I think we are lucky to be able to offer that career pathway for nurses to develop in clinical skills and become more senior within that team. And we have nurses that are on the doctor's rotas, but then we've got to look at what backfills that nurse coming out of the usual role into a new role, and that goes all the way through the chain really of all staff. And that's when you have to start to look at skill mix, and when you have to start at looking at developing new kinds of roles to support, as I say, those registered professionals. We've used here some of our therapists, as I say, nurses, but also some paramedics as well, and that's worked really well. Well, if you're a patient in a hospital, surely it doesn't matter what day of the week it is, if you've got a need, you expect that need to be responded to in a way that is equitable across those 7 days. Our patients give us great feedback. Our services are there for all, 24/7, things like stroke services, cardiac services. So the people and the population that we serve, I would say, have an enhanced service really, because we're able to offer equity across the 7 days. I think our staff have seen many benefits from working across the 7 days. It's not without its challenge when you first look at extending the service to manage over 7 days rather than 5 days, but you can do it in many different ways. So some of our teams have expanded but have brought in a new skill mix, have brought in new roles, which gives other individuals within our nursing and therapies families the opportunity to develop in their roles. So we now take a number of apprentices at 16. We start them on a skills pathway, an escalator really, if you like, and all of the time they can develop along that pathway, and then we can offer them some higher apprenticeships and eventual registration. I think the important thing about 7-day working is that we are here to meet the needs of our patients, and we have to do that in the best way possible. And we can't do that with what we've always had. Number one, financially, it would be sustainable for us, and the individuals aren't out there. So we have to create new roles to support those registered individuals, nurses, doctors, AHPs, to deliver the care that absolutely is only for them to deliver. So I think we've seized an opportunity really to develop career pathways for many more people in our community. If we need to be here at the weekend, we will come in at the weekend. It's often the best time to visit the hospital really. Number one, probably because people don't expect you to be here. But you know, we all do on-call, and sometimes the best place to be when you're on-call is in here. It gives us the opportunity, well, it gives me the opportunity to walk around the wards and speak to people in a less kind of pressurised way, because there's nowhere else for me to be on a Saturday or a Sunday. If I'm in work, I'm in work. I'm not going to meetings or having to go off site. It's a great time to be in the hospital, I think. So I think all of us are open to being here on the weekends. If we expect our staff to do it, there's no reason why we shouldn't. Thing really I would say about nursing, I mean we have to respond. I mean, nurses have always worked 7 days, haven't they? But the kinds of services that we offer now are different over the 7 days, and we're here to meet the needs of our patients, but we have to think differently. We can't do what we've always done with what we always had, because we haven't got that anymore. There aren't enough registered nurses out there, and if we are developing nurses to become practitioners and advanced practitioners, then we have to fill that space with something else. So be open, think differently, don't always think about delivering a service in exactly the same way as you always have. Just think that maybe there is another way, and it will be better for the patient because we can meet their need at the time that they need us.